My name is Dr. Frank Jones, and I'm president of the Atlanta Medical Association, and we'd like to welcome you to our series, Ask a Black Doctor. Today's episode, we're going to be focusing on our students. We have several students. We have high school students, pre-college students, pre-med students, medical students, and residents who have a lot of questions about their application process that has been interrupted by COVID. And we have a panel of experts here that we're going to talk to in just a few minutes. But again, I want to welcome you. I want you to be sure to use our chat box. Send us some questions. We want to shout you out. Please let us know where you're from, or if you're in school, where you're in school. And we're going to go ahead and start with some brief introductions. Again, my name is Dr. Frank Jones. I'm president of the Atlanta Medical Association. I'm a general surgeon by training, but my role here tonight is as president of the AMA. First of all, I'd like to introduce Ms. Jody Hester. She is a college counselor at Woodward Academy. Again, I have to give her a special shout out. She is the college counselor for both of my sons. And so I'm especially appreciative of her being here. Dr. Miller Collier, he's chair, Collins, I'm sorry, we have another Miller Collier in our organization who's also a family medicine doctor. This is Dr. Miller Collins. He's chair of family medicine, Department Associate Dean of Clinical Affairs at Meharry Medical College. Dr. David Rose, one of my prior residency colleagues. He's Associate Dean of Student Affairs and Admissions at Howard University College of Medicine. Dr. Minka Schofield, she is the co-chair of Admissions Committee at Ohio State Wexner Medical Center. Dr. Stacy Higgins, she is Internal Medicine Residency Program Director at Emory University School of Medicine. Dr. Cheryl Heron, she's the Assistant Dean for Medical Education and Student Affairs, also from Emory University. Dr. Cassandra Bradby, she is the Emergency Medicine Residency Program at East Carolina University. Dr. Kevin Watt, he's Assistant Dean of Diversity and Inclusion at Wright State University, Boone Shaft School of Medicine. Dr. Shanita Johnson, a General Surgery Residency Assistant Program Director at Morehouse School of Medicine. Dr. Kawita Phillips, OBGYN Residency Program Director, also from Morehouse School of Medicine. Ms. Fatima Stallworth Bay, she's an admissions counselor at Philadelphia College of Osteopathic Medicine, Sewanee campus here in Georgia. And last, but certainly not least, Ms. Omonivi Agbo-Didi. She's a third-year medical student at Wright State University. So as you can see, we have some heavy hitters here, and we want to jump right into some of our questions. And I want to start out, first of all, with you, Ms. Hester. And again, we're looking at this because a lot of our students have had their educational and training worlds just turned upside down. And so they're going through the application process. I mean, they've missed out on graduation. They've missed out on senior week, missed out on their sports activities for the second semester. So there's a lot of anxiety. There's a lot of grief surrounding this. So we want to try and go through this. And a lot of these are going to overlap depending on just a lot of overlap in the question. So Ms. Hester, tell us a little bit, first of all, like the SAT and the ACT. Where do we stand with those tests right now?
You know, Dr. Jones, I think often it comes down to a two-word answer. It depends. Certainly for the SAT right now, the next SAT date is actually going to be August. They canceled March, May's canceled, and now they've also canceled the June date. At this point, the June ACT is still scheduled, but I really don't know if that's going to happen. Both testing agencies certainly are mindful of where we are and are looking to add additional dates in the fall. They're talking about perhaps allowing students to test at home or to do school-based testing. It really depends on what day it is, what month it is, what we're going to happen. So a lot's in the air, but it really will work out ultimately. But you're right about the anxiety students are feeling. You're absolutely correct.
And you used to be an admissions counselor at college. How will you all interpret these scores when you see them? I mean, will there be a difference? Will you talk about, you know, we have to be nice because it was during the time of COVID? Will that conversation come up, or you still will stick to?
Well, the thing is, for college admissions officers, they're reading students within context. And so, you know, let's be clear, we are all living through this. It's not just our high school students. It's not just college admission. Everybody's living through this. Everyone is impacted in one way or the other. We're already seeing at the undergraduate level, colleges making shifts and making adjustments. For example, we heard the news not too long ago that the University of California system at the undergraduate level, they're going test optional for this fall. Certainly, every single day, it seems like I get emails of colleges that are changing admissions requirements, moving to going test optional for this upcoming fall, for next fall, for the next 3 years. So we already see that our institutions are making adjustments because they understand what our students are facing in terms of getting access to the testing. That's a whole nother issue.
So this is a question that has come up at all levels, and it's a really good question. I'm sure everyone's gonna have a different opinion on this one. When it comes to writing their personal statements, should they write about their experience with COVID? This is from a high school standpoint or pre-college.
Oh my goodness. And so here's the thing, and I often get questions about, well, I want to be unique. I want to be different. Here's the things. As a student, as an applicant, you need to write your story. But you also need to be mindful that as that undergraduate admissions officer, in all likelihood, they're going to see a lot of COVID stories. So if it should be something you'd want to write about, you've got to make sure you're talking about it within the context of your experience, your life. A college admissions officer is reading the essay. It's the only place where they're going to get the student's voice. It's not about grades. It's not about what a teacher says, what a counselor says. It's about who you are in that moment. So that admissions officer is reading that essay to hear your voice. And if you choose to write about COVID, you have to ensure that you're doing it in a unique way that really speaks to who you are. But at the same time, in a given day, an admissions officer is reading 50 to 60 files. And if 49 of their other files that they're reading have written about COVID, you're being the 50th one they read. If you've written about that, maybe you're not going to stand out quite in the way that you would have hoped.
Okay. What about the student athlete who is really depending on this semester to really show what they could do in school? And what about their eligibility in terms of, if they wanted to stay back a year and participate again, would they be able to do that?
Well, I mean, in some ways, there's some good news for our student athletes who are graduating in the class of 2020. What the NCAA has already done is they have waived the test requirements for this year. So perhaps there were students who met the GPA requirements for the NCAA Eligibility Center, but they were maybe a little bit softer with the SAT or the ACT for this particular cycle. For those students entering for fall of 2020, the NCAA has waived the testing requirements. Going forward for the class of 2021, who knows what they will do, but certainly for this year's group of seniors, that's a good piece of news in some ways, particularly if they were waiting to March or April or May to try to boost their test scores. Well, the NCAA has now taken that away as a barrier. But certainly they still need to be concerned about their grades though, and try to finish strong. And I know we focus on, okay, so we have schools that are going past fail for the rest of this semester, but let's be clear, we were virtually 3/4 of the way through the school year. And so we're really talking about this last quarter that has been significantly impacted. And so schools aren't going to overlook the first semester of the fall semester. They're not going to overlook what happened in the third quarter of this year. So in terms of the impact on grades, we're really talking about this last quarter. Given that 3/4 of the year was already done, I think students are really going to be okay given what's happening. And remember, admissions officers are going to be flexible.
And this is a big question. I know you don't have the answer to this, but just your brief opinion on it. Do you think schools are going to be open in the fall?
Dr. Jones, Dr. Jones, Dr. Jones, that is the money question. So I am ever hopeful. I am a positive Polly. I'm an upbeat Ursula. So I hope we will be up and running this fall, but already we're seeing colleges. So I'm particularly worried about the class of 2020 in terms of what does college look like for them. These are students who've been admitted, they're paying their enrollment deposits, but when will they be leaving? Will they be going? There's some colleges that are looking into making first semester actually starting in January. And I think until higher ed, secondary ed, until all education institutions can absolutely guarantee the safety of all of our students, I think it would be a very difficult thing. And in some ways, I see college campuses as almost like cruise ships. I think about, how do you practice social distancing in a residence hall? How are you going to do that in a dining hall in the classroom? So until we get to the place where it really is safe, I just don't know. But that's a big question. I'd love to hear what other people think about that.
And we'll get to that again in just a few minutes. And don't go anywhere, Ms. Esther. We're coming back to you. I have a lot of questions over here in the chat box. We have a question from Michael Hermosa. Michael, send us another chat, tell us where you're from. His question is, can telehealth virtual patient encounters be used as an alternative to clinical clerkship and elective rotations? Dr. Phillips, you want to handle that one first? So can telehealth virtual patient encounters be used as an alternative to clinical clerkship and elective rotation?
So I would say yes and no. So certainly things that are about history taking and kind of fact finding, I think that's very successfully done via virtual visits. However, some of the tactile things that are needed, you certainly are unable to do in the virtual setting. For me as an OBGYN, there are some things that we certainly cannot do. Our recent clerkship of students were completely virtual, but they're going to be coming back for kind of a very short burst experience in the next, I think, month to month and a half, to be able to get some of those technical hands-on. So in short, I think some things, yes, but it also depends on what exactly you're going to be doing.
Okay. And we'll come back to the chat in just a second. But I kind of divided this up into different levels. So these are some pre-med questions. Dr. Rose, you're in admissions office. What about the MCAT exam? What's going on with the MCAT exam? You're on mute right now.
Thanks, Frank. So obviously the MCAT the cancellation of the number of MCAT dates have caused a lot of anxiety in our students. Particularly for us, we have a BSMD program. So most of those students actually take the MCAT fairly late in the spring. So we've had to alter our admission policies regarding those particular students. For the ones who are going to be applying for the fall 2020, 2021 cycle, obviously we're going to have to show some flexibility and start reviewing files probably without having an MCAT score, which we're prepared to do. And it may not end up being too big of an issue because the AAMC has opened up a new set of dates. Beginning May 7th, I think students will be able to start registering again. Hopefully the Prometric centers won't shut them down. But they have added some dates, and they have also stated that they will expedite the MCAT reports and get them back within 2 weeks instead of 4 weeks. So I think that should assist admissions processes.
Okay. You mentioned flexibility. Briefly, what will that look like? Because we're all hoping that admissions committees will be more flexible. What do you think that may look like?
Yeah, at least for us, I don't think this will necessarily mean lowering of any MCAT standard or cut point that we have, but I think flexibility in the sense of maybe allowing a later MCAT date. Right now, we allow MCATs all the way up through January of the cycle that a student is applying to. So January of 2021 is the last date that a student who is applying to Howard College of Medicine can take the MCAT and still be considered for that cycle. So as it stands right now, we still have a fairly lengthy time period that the student has the opportunity to sit for that exam and for us to consider that score. We just completed our interviews back in April. We had to do our last 5 interviews, which were 50 students, all by virtual methods. So I think we're prepared to kind of have late MCAT scores come in for this cycle as well.
Ms. Starworth Bay, you're from PCOM, Georgia. What does flexibility look like at PCOM in terms of the application process?
Basically, as far as the MCAT, I kind of echo the same thing Dr. Rose said. We are considering reviewing well, we're reviewing applications after or without a MCAT, and then holding off until MCAT scores have been received. As Dr. Rose said, they added 3 additional dates, so they'll have a total of 21 testing dates that, of course, we will consider. And like he said as well, we usually accept all the way up until January, but considering other dates as well. So basically the same thing, and we're still in talks of what we're going to do because of the situation.
Dr. Watt, you're also very much involved in admissions. Can you tell us what's going on at Wright State?
Well, everybody's working from home, so not a whole lot with this right now wait list, alternate list situation going on right now. I think we're going to wait it out because we got some information for some of our second year students. They actually finished school in end of January and have about 6 weeks time off to study for boards, and those who didn't take it by March 21st haven't taken it yet. So, and then the centers are telling them one thing, and then 2 days later they're giving some other information. So I just think we're going to play it by ear and just to make those adjustments. At our school, with the last test date we have is in September, so I don't think that's going to work this year, and we'll see how it goes. I think we all make adjustments. Doctors working from home, telemedicine. I'm an ophthalmologist. I breathe on people all day. I haven't been working in 6 weeks. That's not good for me. But I think we all make the adjustments, and we'll see as it goes. And like you said, nobody knows all the answers because we haven't been here yet.
Okay. And Dr. Schofield, you're also in admissions at Ohio State. Tell us, what kind of plans are you all making? You know, a lot of these questions keep coming up. When should I submit my application? How am I going to interview? What kind of plans have you all put into place at Ohio State for that?
I think first and foremost, students should always try to remain competitive. And so if your application is ready, always applying early is best. So if you can submit by May, June, then go for it. As far as the MCAT and the delay in taking the test, I think we will have to be perhaps a little bit more creative. Typically, we do say September at the latest for taking your MCAT. We close our acceptance of applications November 1st. So, and considering that there's this 1 month turnaround, usually we say try to really no later than September so that you can get your application in, because it's not considered complete until that information for us is in the package. So for us, it may require rethinking what is considered a complete application, particularly in light of the cancellations for the MCAT. So yeah.
So would you still recommend that students get their applications in early? That's something we've always advocated for in the past. So you still recommend that?
I recommend that. We do rolling admissions. So, I mean, if you consider that, you know, last year we had over 7,000 applications and only accepting like 200 people or so. I mean, the earlier your application, the better. But I always tell students, yeah, you want to get it in early, but you want your first application to be your best application. And if it can't be your best application, then the fact that you turned it in May or June doesn't matter. So if it means delaying another year, then definitely do that. You want your first to be the best. Okay.
Dr. Collins, up there in Nashville. Of course, students today, I mean, you can't get into medical school today without shadowing. So a lot of students were planning on doing some shadowing this summer, and they may not get that opportunity. What kind of advice, what would you tell that student? How can they make up for the opportunity to not be able to do some shadowing?
Great question. Like many of my colleagues have already mentioned, there's nothing you can do to really replace the real thing. Simulation and virtual encounters only go so far. You know, there's no perfect answer to this. I think they need to continue to be diligent, but as most people's already said, everybody's working with the same, hand. So it's not like one set is going to have another advantage. And the most important thing, just what my colleague just mentioned, I think they really should put their best foot forward and understand that this is a marathon and not a sprint. And if that's the one piece that really could make the difference in them getting accepted, then maybe they should consider deferring. You know, we aren't going to probably touch on this, but you asked for a little dissension. I think the cost of medical education should make some people pause right now because there's lots of uncertainty. And if you know, you get in and nothing happens and you waste a lot of time and money, that can mean different things to different folks. But virtual only goes so far. But I don't know if there's a correct answer for that. As you know, most institutions, I know Meharry isn't allowing volunteers. The liability is too high with COVID-19. So it's just not going to happen right now. And I think the best thing that they could do is just work on the other pieces of the application.
You say they do not allow volunteer?
It's hard pressed to volunteer because of the liability. You know, I'm sure some organizations have disclaimer forms, but we have a bunch of dental students and medical students who really aren't clinically active who are volunteering, and that saturated our capacity.
That was one of the questions that someone sent to us.
Dr. Jones.
Yeah. Oh, well, let me just put that. So I kind of want to get an idea of how many of your schools are allowing students to volunteer if they want to. By show of hands, are any schools allowing? So everybody's shaking their head no. Wow. Go ahead, Dr. Watt.
Well, ours are volunteering. If like we have some nurses, right? So they're going other towns in New York. There's a couple of students that are going to different places. They're already nurses, so I don't think they can really stop them. But from a standpoint of going and doing anything clinically as it relates to the medical education, they're not.
Okay. Dr. Heron, did you have your hand raised?
Yeah, good evening, everyone, and forgive my voice, but one of the things to be clear about is you've seen on the news is the shortage of PPE and the availability of resources to protect our students and frankly, each of us who are working. And so there's a reality of the desire to want to participate in whatever way, shape, or form, but there's also the realities of lack of equipment to keep people safe from a disease that's killing people. And putting students in that sort of situation is just not acceptable, quite frankly. And the other ways to volunteer would have to be thoughtfully done with some clear understanding of what that means. We do value our students in terms of their willingness to participate, but there's also the reality of what the country is facing in terms of access to necessary equipment to keep everybody safe.
Now, I've heard some old school doctors say they decide to go into medicine and they're gonna have to do this when they become physicians, so they ought to get used to it now. Anybody agree with that?
Well, I think the reality is right now, nobody's on that. Like, we get it. And unfortunately, because these students in the fourth years particularly are graduating early, virtual graduations, third years get put on hold for a couple of months. In one respect, we're going to lose something, because if something like this happens at the end of their careers again in their life, they're going to be like, I'm not going to work. I didn't go to med school, so I ain't going to work. That's what they're going to do.
Interesting point. Med student Ominovi, we haven't come to you yet. What are your thoughts about this?
I think that was an interesting point that you brought up. You know, I think we all are excited to enter into the medical field and we're called to serve. But I think a lot of medical students, especially the students that I've spoken to these past couple of weeks, a lot of them expressed a concern about entering into the clinics and knowing that it may not be the safest place for them. So I've heard concerns even early on before all medical schools kind of collectively pulled medical students off of rotations. There were students that were concerned for their own well-being, and even students concerned about the level of protection that they have. And so I think that when you think about the work ethic, Dr. Watt, I think, you know, when you're called to serve, you're gonna show up. But I also see a level of self-preservation, right? You know, there have been healthcare workers that we've seen also protesting. And so I think there has to be this balance, right? Because for the first time, we finally see the country paying attention to who's gonna take care of the providers, who's protecting them. And I think our medical students, they're seeing that and wondering, you know, when I get on the front lines, who's gonna take care of me?
Tell us a little bit more about the state of mind of the medical student right now. What are you all talking about? What are you all thinking?
Ooh, man, there's a lot of concerns on all different levels. So when you're even thinking about medical students or pre-medical students who've gotten accepted into medical school, they're wondering what's going to happen. Is it going to be virtual? You know, they were worried about participating in summer prep programs, especially those tailored towards, you know, minority or disadvantaged students, to make sure that we start, you know, off at the same, you know, level as everyone else. So, you know, students are worried about that, those incoming medical students. I think, you know, our first years and our second years, they're just Zoom fatigue, right? They're tired of all these online sessions, and, you know, our institutions are trying their best to make up for what should have been our clinical rotations with online electives. And I think it's just a lot of frustration, right? There's a lot of unanswered questions. You know, students are having their step 1 or step 2 just canceled out of nowhere, even if they scheduled it months ahead at this point. And like Dr. Watt mentioned earlier, you're getting different messaging. Your school's telling you one thing, the Prometric testing site is posting one thing on their website, USMLE just sent you, or the MBME just sent you another email. So they're very just kind of frustrated, and you're stuck. You don't have the same community. You don't have the same ability to, you know, focus. So I'm actually kind of worried about those students who find themselves in limbo as they're trying to study. Do you take a break for a couple weeks and then pick up the step 1 studying? A lot of our, you know, rising 4th years, their aways are getting canceled. They can't take step 2. I know these are touching into things that will be answered by our amazing panelists, but there's a lot of fear, a lot of frustration, a lot of anxiety. And, you know, I am worried about the mental health of our students. I'm worried about the level of motivation, and just, you know, just have to continue to remind them to just have grace, because their administrations are just, you know, in the same, you know, precarious situation trying to find answers.
So you think the number one thing that's missing, or the number one thing that the students wish they had, was better communication about what's going on?
Yeah. And it's hard, right? But yeah, I think getting better communication, and then also just like alternatives, right? So I know a lot of students have been, you know, really creative at their institutions. Some students have created their own electives for themselves or their classmates to participate in. They've reached out. I know at my medical institution, some students are actually volunteering with the public health department. They can't be in the clinic, but they can help out the public health department, answer phone calls, data. So they're finding different ways to keep busy, finding different options. But I think the communication would be really helpful, because, you know, it's very anxiety evoking when you're trying to figure out what your next steps are. You're trying to meet the requirements of your school. They don't have the answer. Prometric is sending you another email, you know, every other day. You're getting surprises with a cancellation and a reschedule that you didn't plan for. And also,
So let me ask, we've got some deans of medical schools on here. How can we communicate better with the students? They say we're not communicating well. What can we do better to communicate with the students? Anybody? Any? Go ahead, Dr. Heron.
Well, I think the schools are doing as good a job as they can. They're getting the information. They're getting it to the students. Now the students don't necessarily like what they hear. Here, a couple of weeks ago, the dean of the medical school and associate deans of medical education and student affairs all had a class meeting virtually for each individual class to go over some of those things. And I wasn't on there, but I heard from some students, it's just a lot of unknown. So, you know, students these days, they want to know.
Okay.
And, you know, just got to get with the program as far as I see it.
Dr. Heron, you had a comment?
Yeah, thank you, Dr. Watt. I would agree. I think it's what the answers are, which is not quite what people want to hear, which is, I don't know what's going to happen. And so that's just the facts of the matter. And when you hear that answer, you know, the key thing about this is, how do we manage change, and how do we adapt through growing through this resilience? I was reminded by a student at Emory who suffered through Hurricane Harvey and Maria in Puerto Rico. And she was medical student in those schools, and she, you know, came up and is now doing residency. And she had to just reset a couple of thinking for some folks. She said, yeah, we got it bad, but you weren't in Hurricane Maria and Harvey. I mean, it's your perspective. And there has to be a trust that people are doing the very best they can, have their best interests at heart. Everybody's on the same page from the highest level of AAMC, LCME, ACGME, and all the alphabet soup of our leadership organizations. And we are, certainly communicating one-on-one. There's a data I read that what students really need, in addition to town halls and all this other thing, is just the one-on-one high-level conversation, as much as it can be given independently, to walk people through bringing out their nimbleness and their resilience on how to manage the unrealistic part of change. And as an ER doc, I live with change every day. I don't know what kind of day I'm gonna have every day I go to work. So
that's a good segue into my next question. I was gonna ask, we're gonna jump back and forth. So let's go to the clinical years. Dr. Higgins, are the virtual clerkships, are they effective, and are they achieving what we need them to achieve for our learners to become good physicians?
So I agree with what Dr. Phillips was saying earlier. I think there are some things that you can learn on a clinical clerkship virtually, but much of the clinical year is about being hands-on, whether that means examining a patient at the bedside and reviewing that exam with your resident and your attending, or being in the OR and practicing a procedure, learning a new procedure in the emergency department. And so a virtual clerkship doesn't effectively allow a student to really participate and know, is this a field that I'm interested in as a career? And what am I gonna learn from this particular clerkship that I can pull forward in whatever career I'm ultimately choosing to go into? That being said, we are where we are. And so we're having to deal with the situation that we're in. And I think as Cheryl, Dr. Heron was saying, we're doing the best in the circumstances that we have.
Dr. Johnson, you're a surgeon. You're the assistant program director at Morehouse School of Medicine, and Dr. Bradley, you're the program director in emergency medicine. Two rotations that it just doesn't work well virtually. What are you all doing right now and what are you going to do in the future to be able to evaluate students that want to do a surgery residency or want to do emergency medicine? I definitely wanted to have a good representation from surgery and emergency medicine on here, because that's a lot of the questions I've been getting. How do we make up for that lost time?
WebEx.
Right.
And I've eaten already, so take your time.
It's impossible to do a surgical procedure virtually, right? So there's definitely a deficit there. We try to use simulation and video-based education as we can to sort of fill the gap. But as soon as we can get our students back into the operating room, that's what we want to do. We want to get them in so they can have access to these procedures. Having said that, medical school is a marathon, it's not a sprint. There are other rotations that you have access to procedures in, so gynecology, emergency medicine. So you can get an idea of a procedural residency is one that you're looking for. As far as evaluating for residency positions, it's a fluid situation, but we are all in this together. So we understand that the students may have had a shorter rotation or no rotation. And this is something that will probably come up in the interview as we discuss with the student their individual route to their interview and to their choice of doing surgery or GYN or whatever procedural based residency that they're choosing. So the answer is nothing is set in stone. We're doing what we can to get this access for students.
Dr. Bradley, what are your thoughts on that?
So I agree, you can't do surgery or emergency medicine virtually. It would be pretty much impossible to really get a great experience and a great idea of what either of those specialties is like via telemedicine. I will say, though, that I don't think that telemedicine has ever truly been emphasized in medical education the way I think it's about to be in the coming years. And so these students are going to get a different experience in their clerkships than all of us had, of course. But I do think that telemedicine is going to be very big in the future, and that to some degree they will benefit at least from that piece of this experience. In terms of emergency medicine, our organizations have already come out and said that we are aware that this is a problem. We are looking forward to the fall in terms of we are recognized that it's going to be hard to get letters of recommendation, that we are going to be okay with just having one as opposed to our usual two. And we also understand that there are some schools that do not have an emergency medicine rotation or residency program, and they may be unable to get a letter from a residency program, and that we are going to do our best to overlook this and try and take everything into consideration with all of this. I think the other thing to keep in mind is like we are all in this together. Like it's hard to tell somebody what to expect in the fall when we don't know what's going to happen tomorrow. Like our clinical schedules as attendings look different 24 hours before the shift starts than it did last week. So I think I struggle with being able to say I don't know, especially as all of us are used to a specific schedule. Like this is how this works. In July, we do orientation, and in August, we start prepping for ARIS to open in September and kind of down the line. And so now all of that is shot out of the park. So we're all flying blind kind of together. And I think because of that, students are definitely going to get grace in light of all these changes.
Now, what does that grace looks like? I mean, and the reason I wanted emergency medicine well represented here, you and Dr. Heron, because that's one of the most popular residencies sought after now. But when you're sitting around that table trying to decide between this student and that student, and you haven't been able to see either of them do a sub-internship, what are you going to base it on? What's that conversation going to look like?
I think at that point, it's going to look like what types of letters did they get from the other services. The lovely part about emergency medicine is that we get to do a little bit of everybody's specialty. So letters from any specialty do speak to how you would perform in the emergency department to some degree. So I think that we are blessed as a specialty from that point, just that we do get a little bit of what everybody else gets to do.
Dr. Phillips, procedure-oriented residency program director, what are you telling your students that want to apply for OBGYN? Well, this is what we're going to be looking for.
To be honest, we're going to be looking for what we always have been looking for, which is going to be people who clearly show an interest and have, good letters of recommendation. Certainly, we will have to take into account that some students might not be allowed to do their sub-Is, but they should have clerkship experiences. And even if it's not an OBGYN, the hope would be that they've gotten some type of surgical or procedural related experience. And so they should still have enough information for us to be able to make a decision. But at the end of the day, I mean, we're going to be choosing the students we think are going to work best in our environment. And that's going to be based off of not only who they show us to be when we interview them, but also who they've shown themselves to be on the rotations that they were actually allowed to do.
I got into a little discussion, we'll call it, with some folks at PCOM, and they were talking about, well, we need to make sure that we have a very robust simulation program, or we have to make sure that we see how they use their hands. This was a surgery group talking. And Dr. Johnson, you and I know as surgeons, and Dr. Watt, but surgeon, and for the other groups too, and you, Dr. Phillips, as well, it's more so about judgment. And we can always, evaluate someone's judgment just through the interview process or through their experiences. And so I'm not that concerned that a student hasn't been able to do a surgery rotation or OBGYN rotation or emergency medicine rotation. I'm more concerned about their judgment. Anybody disagree with that?
I don't disagree with that at all. I think the disadvantage of not being able to go through all of the clinical rotations is just, as a student, really figuring out what it is that you want to do and apply for in residency. I agree, as a student, while you may be participating quite a bit with your team at the bedside, the reality is you're not doing that much that your skills that you're going to bring with you into residency are going to make that much of a difference. Most of your skills are acquired during your residency training, but I do worry about students who haven't had a full experience in a particular rotation, because so much of deciding what am I going to do next is, are these my people? Do I enjoy getting up and going to work every morning? And that is the piece that the students are missing out on.
And I
Let's
just
talk a little bit
want
about
to echo that. I think that is extremely important for surgical specialties. So I'm an otolaryngologist.
I forgot your surgeon. Please forgive me for not mentioning.
No, you're fine. You're fine. And I just think that, students need to know that they're comfortable in the operating room, that this is your place. You feel comfortable here. And so often people say, I want to do a surgical specialty, and they get in the operating room and it's not even what they expected. And you would hate to have a situation where a student wasn't exposed to that. The rounding's different. The patient interactions that you have are just completely different. And so you kind of need to know, can I do this for the rest of my life? Is this my place? So I think that's the one element that's missing. You're right, it's all about judgment, and they aren't going to come in with some surgical skill set that makes me say, oh yeah, but I do want to know that you're comfortable in this arena. And that's, I think, what's going to be missing.
Yes, Novi.
So I don't have an answer. It's actually a question. So for those students who, their third year was cut short, they weren't able to do the rotations, especially maybe in that specialty that they want to go into, how do they move forward now that, their aways are getting canceled, and they're looking at how to prepare for the ERAS application?
Who wants to add? Okay, Dr. Phillips.
So I think that the aways getting canceled is one thing, but they should certainly try to do sub-Is in their place where they are medical students, so that they need the feel. It cannot be said more than Dr. Schofield already said. You have to know if these are your people. You have to know if you can do this work. And you cannot find that out virtually. You must be around those people. You have to figure out if you can handle what it is. Can you handle the 6 a.m. rounds? Can you handle being up and being called and being expected to be lucid and functional at 2 a.m. You have to figure out if you can do that work. Do you even like any of these people? Maybe you need to do something else because these are just not the people that you're going to vibe with. So it's not going to feel good for those years that you're training. So they need to do what they can do in the spaces that they're in. If they're in, one of the benefits that we have in Atlanta is that we have some places where there are joint places where schools are, like Grady Hospital. And so if they have the opportunity to do a sub-I with the other school, that will be a great opportunity for them, even if they have no intention of going to the other school, just so that they can have more exposure to the field.
Okay. I apologize because I didn't see all these messages in the chat. We have a lot of messages. Let me try and get to some of those. There was a question from one of our frequent flyers. She's been on every one of our shows, Ms. Latricia Pitts. She asked the question, will medical schools accept online science classes if taken summer or fall due to COVID? And Dr. Rose commented that we've made the decision to accept online science courses this summer, including labs. So that's good. I think most schools probably will do that. Here's a question that came up. How about training technical skills in that pandemic crisis? COVID-19, any advice there? So another way of framing this, again, in those surgical specialties, particularly in the surgery, OBGYN, and some of the, where you have to have a certain number of procedures as a resident. And now you've lost out on months and months and months. And even, in the primary care residency as well, you have to have a certain number of encounters that you do or procedures that you do. What are we going to do about that?
The American Board of Surgery is looking at the case totals and case requirements. So there's a certain number of cases that each surgical resident must graduate with, and a certain number of time that you must be in a residency program. Of course, that's now been affected by COVID-19. And so for most of the chiefs graduating, that really wouldn't affect their numbers as much. By this time, they've usually completed their case requirements. But for our third and fourth years, it may. And so it's a fluid situation right now, but it's being evaluated at that level, at the Board of Surgery, to determine what those requirements will be, both for the time away from residency and also for the number of cases and how that affects them actually sitting for their boards.
Dr. Collins, what about from the primary care field? You all have to do a lot of procedures, have a lot of encounters.
Yeah, much like with CMS and a lot of the other authorities, flexibility is going to have to be there. The American Board of Family Medicine has already said that they're going to drop that total 1,650 visits in ambulatory settings, but they're also given the flexibility and the leverage to let residents use virtual encounters, also to use some of the volunteer efforts that they're doing because of the COVID-19, if they can quantify those. Malpractice has been too expensive, so a lot of family physicians have stopped doing OB. So that number that we had of having 40 deliveries has already changed. Now it's looking like other specialties, cardio, neuro, just said that we need some experience. And just to quickly add to the conversation you guys were just having, I think we need to kind of determine some of these answers by leaning on some of the powers that be. I think the ACGME is going to have to change their approach to GME funding limits because of some of Dr. Phillips was just, bringing up some excellent pearls about how even now in the best circumstances, a lot of students are unsure because of their experiences which specialty they're going to go into, and they change. And sometimes those barriers that were there that prohibit them from changing, like GME funding, when they try to go between specialties, I think CMS is going to have to change because now with these unfortunate set of circumstances, you're going to see a lot of people shifting. And I think that the powers that be are going to have to accommodate.
Okay. I just want to mention that question before about the technical skills came from Dr. Amar Mohammed. He's a cardiac surgery fellow in Algeria. So we're reaching Algeria. All right. Let's see. Here's actually one of my mentees, Ms. Val St. Flo. She's actually been accepted for this upcoming year. Congratulations. For those of us who have been accepted for this incoming fall, what are some of the things that we can do if our start date has been pushed back? So who wants to jump on that? And before you answer that question, I do want to stop before I forget it. Is anyone aware of summer programs? What has happened to summer programs? That's something that we always push for our pre-med students. Are we still gonna have summer programs? Are they gonna be done differently? Anyone can comment on that as well.
Well, right now, even our pre-matriculation program, as well as our program for rising high school juniors and seniors, we're kind of proceeding, still taking applications and beginning to review those applications, but we don't know when the institution is going to open back up. So we're going to be prepared if we can have the programs to have them. Some of them have been going on for 40 straight years, and we don't want to lose it. But obviously, a lot of that comes with clinical exposure to doctors' offices, and if the doctor's not really working, he's definitely not going to expose the student or expose his patients to those students. So I think it's, again, Dr. Jones, it's all in the air. I mean, it's in the air. This thing could change tomorrow. In Ohio, they started elective surgeries coming up on Friday, and everybody, doctors and dentists, can go back to work that weren't on Monday. But it's all played by ear. And personally, I think I'm gonna probably open up in a couple of weeks, at the least.
Dr. Rose, you can ready to comment?
Sure. We participate with the SHEP, the Summer Health Professionals Education Program. We're one of the sites, and the Robert Wood Johnson Foundation pretty much asked all the sites to
Can you tell some of our students that may be watching that may not be familiar with that, can you talk a little bit about that and what that is?
Certainly. It is a 6-week program that is held, I believe, at 12 or 13 sites throughout the country, designed for rising second and third year college students who are interested in medicine, dentistry, pharmacy, nursing, and a few other specialties. And there's a fairly competitive application process. We at Howard, we take 80 students, college students, for a 6-week program, usually 40 in medicine, 20 in dentistry, and then the remainder between pharmacy and nursing. And it's essentially a prep program to get the students ready for that particular specialty, going through science coursework and so on. But it's a very nice program in the sense of the bonding that occurs among those students over that summer program. So the Robert Wood Johnson Foundation, which sponsors it, has asked all the sites to continue the program this year, but it's just going to be online. So they're gonna lose that in-person feel. I'm not sure how it's going to go. Typically, the most fun part for the students is the portion of the project when they actually come over to the hospital and do some clinical shadowing, and that's not going to happen. It's going to happen in some sort of virtual way. So But it's going to proceed online. For us at Howard, we also have something called a pre-academic reinforcement program, or a PARP program, which has been in place for probably more than 40 years. It's a 6-week program. It's a conditional acceptance to the medical school, and the students have to basically take the first 6 weeks of med school classes and pass it, and then matriculate in. And we're going to continue with that program, and it'll just be virtual.
Okay. And for Val's specific question, if she's been accepted, but if they start school in the fall, Dr. Higgins, what are some things that she should think about doing to prepare herself for the fall?
So this is assuming that the fall initial start date has been pushed back, and so your summer is extended longer than, I mean, you could potentially, I guess, start reading a little bit ahead. It's pretty standard that every fall medical student will start with the sort of standardized courses of anatomy and a little bit about taking a history and physical exam. There's also the opportunity, if you can get involved in any service activities in the community that you're going to be moving to start getting involved a little bit with those things. Yeah, that's kind of all I can think of for before you actually start medical school.
Any other suggestions? Okay, we'll keep moving. Some more questions. Omanova, you said you had a question from a high school student?
Yeah, so actually, this past year I've been getting my master's at University of California, Berkeley, and I actually did a couple projects with their admissions program. So going back to some of the things that Mrs. Hester was talking about with the changes, I know that the Berkeley is also considering that, you know, summer and fall will be online. They're just trying to play it by ear to, you know, understand what direction they're going to take, and what they're just recommending to students right now. Like if you've been accepted to the colleges and you're still trying to decide which one to go, they really encourage students to go on the website, go on virtual tours to help you choose and decide what college you want to attend, since you can't, you know, go in person. And also if you're thinking about applying to these schools, you know, in the upcoming fall, just to really pay attention, because they're going to be changing a lot of their admissions process, right, in terms of getting admissions to college this upcoming fall. So they're also playing it ear by ear, day by day, but they're definitely having those conversations to figure out how to, you know, serve all these high school students who are planning to apply.
Ms.
And
Hester.
I think that's an excellent point, but I would suspect that for our rising high school seniors, for our college seniors who are looking to med school, it really is the same. That how do you do research when you're not able to set foot on these campuses? How do you do that? And so certainly at the undergraduate level, I think our colleges are being very nimble in terms of creating virtual visit programs. Admissions officers are probably far more accessible now than they've ever been before. Certainly we see colleges coming together and hosting virtual college fairs for high school students. And so I would hazard a guess that we're certainly seeing the same things for our medical institutions as well, that and again, I told you I'm a positive person. And so if there is anything that I think COVID has done, it is forcing us to rethink and look at how we have gone about doing the things that we've done, and to really question, is this something that was really helpful? Is this something that was really needful? And really forcing people to look at those structures. And so I think we can't go back to what we've done before. Everybody has been changed. And so if we're starting in the fall, if we're starting in January, it's going to be different. And I think we're all going to be changed, and certainly higher ed in a lot of ways is being forced to change. And so I already see that, certainly in terms of being more accessible in this digital landscape at this point.
And again, this is April 29th, and May 1st is the date that most colleges have set for picking. What advice would you give them? I mean, if they're stuck between 2 or 3 places, and again, they can't go on campus, they can go and see the virtual. I mean, my son has gotten so many virtual Zooms this past week. It's been great to look at it, but what advice would you give them in making that last minute decision?
And so first of all, I would encourage for any high school senior that is still trying to make that decision is to reach out to the colleges. We certainly have seen massive movement to colleges moving away from the May 1 National Response Day. So some colleges have already, hundreds of colleges have already said, it is now going to be June 1st, not even just because students aren't able to do the visits, but also because of finances. Because of what we're living through financially, families that thought at one point, here's where we are in February, they're now looking at the finances and realizing, no, we're not going to be able to afford this choice. And so colleges understand that. And so they've extended deadlines to June 1st. There's certainly any number of colleges that have not done that, and they're holding to May 1, but there is some flexibility. So I would encourage a high school senior to reach out to the two colleges they're deciding and ask for an extension of that deposit, but make sure you're proactive and call, because there are some places that are going to hold to that May 1. And if you don't have your enrollment deposit, your intention to enroll in by May 1, you very well could lose your space. So I think the best thing is to communicate and to reach out to those institutions. And then certainly to make use of your school counselors, to make use of these people. I mean, I'm readily available by email and Zoom to my students. And I certainly think that's the case at high schools across the country, but it is important to find out what are the policies at the institutions that you're considering.
Another quick question for you, and I see you on, let me ask one more question of Ms. Hester. Is COVID and having to start school late, is it going to affect financial aid scholarships? Are schools going to have to give money back for time lost over this past semester?
It's not, I don't believe it's going to impact any aid that's been awarded, merit scholarships that they have already awarded. But for example, we already saw institutions refunding students because of housing and meal plans. So if anything, if there are late starts, certainly the budget of what the cost of attendance will be shifted, and that will be reflected in aid, but the percentage will be the same and things. But again, it's one of those, it depends on where we're going to be. But if a student has been awarded a merit scholarship and things start in the fall, they're still going to have that aid. They're still going to have that award. Colleges are not going to take that back.
Okay. Oh, I'm coming to you. Let me just make a comment that we have people that are trying to get online, and we have so many people online that can't even get on. I would recommend that you can go to Facebook Live. You can, Emmanuel, you can tell your friends to go to Facebook Live and they can see it there at atlantamedicalassociation.org. So that's one thing that you can do. Maniva, you had a comment?
I was going to advise for those high school students trying to figure it out. I'd also recommend talking to students as well, whether that's through, a campus organization like a Black Student Union, or whatever is important to you, because culture and community could be a deciding factor between whether you choose to go to an HBCU or PWI, a predominantly white institution. And I think in talking to students, take it with a grain of salt. Everyone's experience is different. And so you don't want to internalize someone else's experience. But I think that's really important. I think something to also ask, just because the nature of where we're at is, if you do reach out to a current college student, ask them about their experience, ask them about how it was transitioning to going virtual, right, this past spring, because who knows what this upcoming fall may bring. So I remember being at Berkeley, it was like a very quick and seamless transition to virtual platforms, and that may not be the same on every campus. So that may be, things you just want to ask about and inquire so that you can be prepared for what may come.
Let me just read a few comments that are coming up. We're getting some great comments here. From Brittany Hazard. Many of you know Brittany. She's very prominent in the SNMA.
She is the chair of the SNMA and will be running the organization this next administrative year.
Oh, okay. So she is a USIMG student, and she's saying, unlike many US medical schools, we don't have the option of alternative rotations such as virtual electives. In some cases, we have been advised to take a leave of absence. Very interesting. I've had a lot of students, a lot of questions have come up about taking a leave of absence. There are some scenarios where it might make sense, something to certainly think about. From Al, I hate virtual rotations on family medicine now and not enjoying online modules. but it is what it is. I do feel like I'm not getting my money's worth. We're probably seeing that from a lot of students. A lot of students probably have that sentiment, but I'm sure there's some students that say, hey, I love this. I don't have to get up at 4 o'clock in the morning and go meet Dr. Johnson for rounds. I love surgery. Let's see, telehealth becoming a staple. We talked about telehealth. Will residency application deadlines be pushed back? Anybody, any of you residency program directors, are you pushing your residency applications back, deadlines?
So I can talk a little bit about that. I think the timeline is pretty standardized across all specialties, with the exception of, I want to say, optho and derm, which optho and urology, which have early matches. But there has been a lot of talk at the AAMC and ERAS level, and I know in the program directors of internal medicine professional organization, there's been a lot of push for the application deadline to be moved further into the fall. It's likely that many of those interviews, I see in that question, will interviews be virtual? Probably. We don't know what things are going to look like in the fall, but for example, in internal medicine, we interview nearly 500 applicants. And so the thought of trying to get 40 people in the room at one time when we're socially distancing is probably not going to work. But there is a lot of discussion around pushing that timeline later into the fall, which would allow people who haven't finished clerkship year to be able to get through all of their clerkships before having to submit an application through ERAS, and then sort of shortening that timeline between when applications are completed and when match day would be, instead of it being a full month, maybe a little bit shorter.
This is another question off subject a little bit, but I'm curious how many of you that are at majority institutions have incentivized programs in your residence trying to get diverse residents to come to your programs. Do all programs have that now? I know, Emory, you all do. Anything like that at Ohio State, Dr. Schofield, where well, I know you all have an excellent track record with diversity and inclusion, so it's not even fair to ask you all. But I'm just curious how many schools actually have formal programs where they are really trying to recruit diverse residents.
So you want me to answer or no?
Let's get Dr. Bradby, and then you can come back. Like I said, I know you all have a fantastic track record with diversity and inclusion. Dr. Bradby, what about at East Carolina?
So East Carolina, for the medical school, Brody School of Medicine has actually had a very large push in order to increase diversity amongst our medical students. Like, their goal is to match the diversity of the state of North Carolina, as our school only accepts North Carolina residents. In terms of the residency programs, it's very different because each program has different things that they look for depending on what your specialty is. There has been talk of the GME office as a whole looking at giving some sort of visiting scholarship to underrepresented minority students to try to increase diversity amongst our residents. But now that we are probably not going to have away rotations this year, I'm not quite sure how that's going to pan out.
Okay. Dr. Schofield, how do you all do such a great job with diversity and inclusion? What kind of, in general, I mean, what are you all doing to get such a great diverse population of students there?
I think for med school, it's kind of multi-layered. Probably about maybe 5-8 years ago, we were really having issues with women. And so we developed this very targeted program going out to surrounding colleges, having kind of mini sessions with females specifically to try to encourage them to come to our med school. And so from that point forward, for the last about 5 years or so, 4 to 5 years, women have exceeded our male med students, which was several years ahead of what we currently see with the trend. As far as underrepresented in medicine, I think the biggest push was making sure that everyone on our admissions committee underwent an implicit association test to understand what their biases were, because there were so many unconscious biases that, many unconscious biases that exist. And I think it's very important for people to be aware of what they are. In addition to that, we require that the admissions committee was diverse. I think when you don't have a diverse admissions committee, you tend to not accept very many diverse candidates. And so ensuring that there is a certain percentage of participants in our committee were diverse also contributed to that. And holistic review has really, really played a key role in us being, thinking of all of the experiences, your metrics, and the attributes of the applicant in a more equitable way. So much emphasis is placed on metrics, and I think there's more to a good candidate that extends beyond metrics. And lastly, I think it's about, we have a MedPath program, which is a post-baccalaureate program. And even though it's not targeting specifically underrepresented in medicine, a great majority of these students are in this program. And they receive an automatic admission to Ohio State if they take the MCAT and reach a certain score. And that score is a lower score, but they have to cross that threshold. I do think that there's still work that needs to be done as far as once the question that I always ask is, we're improving the diversity, and you're right, yes, we have improved the diversity in our medical school, hands down. My question has always been, is the institution ready for that diversity? Can it deal with many of the challenges that all of this diversity brings? And so I think that's where the work is needed, to just provide more supportive measures for these students once they're admitted.
And Ms. Stallworth-May, you're at PCOM, and we haven't really talked about DO schools. How are DO schools faring during this COVID pandemic? I mean, are you all doing anything different at PCOM to try and help the students get past this? And even in the admissions process, what have you all talked about? How have you had to adjust during this pandemic?
Actually, for the most part, kind of the same thing everybody else has been doing. We usually have a later admissions deadline than MD schools. So as far as applications, it hasn't affected anything on that level. Like I said, with the MCAT, again, we have made the decision to look at applications before they have submitted that for now. And as far as classes going virtual, we're still in the talks about for fall if the classes will begin and they will begin virtually. We haven't decided on that just yet. We're still in the talks, but we're just kind of winging it, kind of figuring out what everybody else is doing. We've transitioned. It took us a little while to transition into virtual, but we've made that transition, and now we're just trying to work with it.
What about under normal times? And for transparency, I'm on faculty at PCOM in Georgia. Why should somebody go to DO school? And other than, I mean, and can you dismiss the belief that it's easier to get into DO school than it is allopathic schools, that the standards are lower? Can you talk a little bit about that?
So, so I can talk about that. And I'll just kind of base it off of our averages. And this is for our averages specifically at PCOM. So the average MCAT for our institution, the Georgia campus, is the 506, and then the average overall GPA is a 3.5, and the science is a 3.5 as well. So the MCAT, a lot of students look at as a lower than applying to a MD school, but those are the averages. We don't say that we have maximums and minimums. We don't have a minimum. It's a holistic approach, and you'll hear that a lot, but it's a holistic approach where we look at everything, including like healthcare experiences and different things like that. So that's how we come up with those ranges. So if an applicant is like on the lower end, say they may be on the lower end of an MCAT, say like a 495 or something like that. I say it's good to be on the higher end of maybe your science GPA, your overall GPA, and have a lot of experience, healthcare experiences.
Okay. Another question from a fourth-year student at FIU. Any suggestions on how a pre-med student can stay busy during this pandemic to remain competitive? How do you think applications between surgical specialties for students who complete their rotation early versus those who had their rotation cut short? Do you think step 2 CS will no longer be required? So that's a lot of questions in there. What about the students that got a chance to finish? Okay, I see you, Dr. Bradley. Got a chance to finish their rotations versus somebody that didn't get a chance to finish their rotation. How do you look at those students differently?
So I'm going to be honest, I think that the student who finished their rotation is going to be in a better position than the one who was unable to finish the entire thing. So, I mean, even from like the most baseline level, not just experience, but a lot of medicine has to do with networking. And that goes all the way into medical school, because we're talking about letters of recommendation just to get into medical school from a physician. As well as like into residency. So a lot of your application, particularly now that there's going to be issues with getting step 2 CS and CK taken in a timely fashion, like I do think we're probably going to have to lean harder on some of these other components of the application, particularly letters of recommendation. And so if your rotation was cut shorter, you have less exposure to some of that faculty that would have written you those letters to speak to your capabilities in their specialty. So I'm not going to say that those who didn't finish are not going to be at a disadvantage. For the question about step 2 CS going away, remember that step 2 CS is not just about medical school. Step 2 CS is required for medical licensure.
Can you tell some of our students what step 2 CS is that may not know?
So step 2 CS is only offered in 5 cities, I believe, across the country. It is one of the 4 steps to medical licensure in the United States. It is an in-person test where you go from room to room and see standardized patients, address their complaint, and then write a note about what it is that you think was going on. And you're pretty much running, I will call it a faux clinic for an exam. And that particular test is going to be hard to do, I think, this year, given that they're going to have a shortened amount of time to get all of these students through with only 5 places to take it in the country. But I also can't say that I really think they're going to completely cancel it, because it's going to be required for licensure to get your medical license after residency as well. So even if medical schools do cancel it, I'm not sure that we're going to say that you're going to not have to take it at any point.
Okay. Here's a question that came up, and I won't open my mouth yet. I'll see what you all have to say. My admissions people. How may the admission requirements for a student coming from a Master of Public Health program applying for fall 2021 MD program and passionate about preventive medicine? So someone who's gotten a public health degree. So they've gotten a public health degree. Just what do you think about a public health degree? This is where I really was going. A lot of people think that getting a public health degree will help them get into med school. And I tend to caution students against doing that. I have a public health degree myself, but I don't think that's the route to go to get a public health degree to get into medical school. If it's something you're passionate about, that's one thing, but I don't necessarily encourage my students to go while I'm waiting to get in med school, get a public health degree. Any comments on that from my admissions people?
Yeah, I would agree. Frank, Omo knows how I felt about her even going to get this MPH she got out in Berkeley. You need to have a reason to use it. And
she's already in school, so that's a little different.
Well, I'm just making comment because I know what she's thinking. But the reality is the MPH, the master's degree, is not going to get you, show anybody that you can do something in medical school, because we expect you to get an A because you're not taking that many courses. If you needed to really just go get some time to take your MCAT, then do that. I personally think that students that are going to need a gap year or whatever, they should decelerate their senior year into 2 years and stay at their home institution, and then, beef the GPA up that way, because it only, to me, that makes some sense, because I got to go pay some more money at a foreign institution, particularly on the graduate level, that we know is not what we're looking for if we have some reservations about that applicant's package.
Dr. Collins, you're shaking your head. You agree with that?
I agree with a good part of it. I think we have in my department, we have family medicine residency program and a sports medicine fellowship, but we also have occupational medicine and preventive medicine. And they do get an MSPH as a part of their preventive medicine. So specifically for that question, I think the more that they do in the area of public health, the stronger they're gonna look to the preventive medicine programs. But I was shaking my head. I agree with Dr. Watt. We have so many students who want to get in medical school and dental school, and we don't have the post-bac program anymore that we had at Meharry. And a lot of people go back and forth between students entering our new precursor program, which is a master's in health sciences program, because many people say it doesn't really help them. It's expensive. They can't get gainful employment. It's very, very difficult time. And unfortunately, many students get a lot of bad advice about how to get to medical school. But specifically for a career in preventive medicine, I think any public health training will make them a stronger applicant.
Okay. I know my producer, Bridget, is trying to cut us off here, but we probably have about 15 minutes to go. We still have a lot of questions coming in. A lot of questions coming in about pass fail. Do you have to divulge whether or not your school decided to use pass fail, whether or not you're applying to college, whether or not you're applying to medical school, residency? Are any of your programs talking about students having to divulge whether or not they switched to pass fail for this past semester? Dr. Bradley.
I have a question to clarify your question. Wouldn't that show up on the transcript that it was pass fail? So you wouldn't have to divulge it when you submit your transcript for your application. It should theoretically say that.
That is true. Well, let's switch it up. So do you think it'll make a difference?
Well, listen to this, Dr. Jones. There are some schools right now that have allowed students to go pass fail or receive a grade. There are some schools that you have to make that decision right about now. There's some undergraduate institutions that are allowing you to see your grade and then make that decision.
And what about Ms. Hester, those schools that have said in high school and elementary school, middle school in particular, they've said you can't make any lower than what you already had starting this semester off. Do you think that makes sense?
It's a difficult thing. And so this is, again, and my favorite two-word answer, it depends. So for example, for my high school, for our school, we had that conversation for this quarter, for this semester, second semester, are we going to go pass fail? And after doing extensive research into the NCAA and eligibility requirements, after thinking about here in the state of Georgia for our undergraduate students, they still have access to the Hope Scholarship Program, and concerns about if we did pass fail for the semester, how would that potentially impact students' access to the Hope Scholarship Program? We made the decision to continue with grades. Certainly, I think our faculty had to be a lot more flexible in terms of what that would look like, but we made the decision not to go pass fail because of some of these other entities that we know our students will be encountering. But here's the deal. If your institution, where you are, your school system, they have decided to go pass fail, going forward, that you're not responsible for that. That's it, as Dr. Bradley said, that's what's going to show up on the transcript. A P for passing, A through D, there you go, you get a P for passing. And so institutions just have to wrap their heads around what's on the transcript, the credential that the student is presenting.
Here's a question that's come up quite a bit, and this is from Kayla Davis. How do you suggest pre-med students go about asking for letters of recommendation from physicians? You haven't had a chance to have that up-close interaction with them. How do you go about asking for letters of recommendation? Dr. Schofield?
Well, I'm hoping that right now isn't the first time that you're starting to go and talk to some physician about going to medical school, because you're just a couple months from putting this application in. And Dr. Haynes at Morehouse always used to say, when you ask for a favorable letter. If anything I do, I ask for a favorable letter. And my personal opinion, and I get a lot of pushback on this, is that every student I write a letter of recommendation for, I give them a copy of it. I have every letter of recommendation that was written for me from going to medical school and going to residency still in my possession. I think it's important that if I can't let that student read what I write about them, I'm not going to write it. That's just my personal opinion. But they should have had some experience, long range, for those who are just young in college, you got to have long range experiences. I don't say you need 100 hours of shadowing, because personally, 100 hours of standing behind somebody doing nothing doesn't mean anything to me.
Okay.
Need some
Showfield.
active
And what if they're
engagement.
concerned about a physician's availability now? Like maybe granted earlier, you know, they said, yeah, I can get it to you by May 1st. And this was back in January or so. And now with COVID, you know,
We're all available now. We're all just sitting around on Zoom. We're all available.
Well, I was just going to say that I think it's very important what Dr. Watts said about asking for a favorable letter and making sure that when you are asking people for letters, that you yourself feel like you've developed a relationship in some way with this person. There's nothing like getting a very lukewarm letter or a letter that doesn't support you. Yeah, you have the letter, but it doesn't support you. And so if I try to counsel students very early on, and I'm very type A, and people ask me, oh, you know, should I know what I want to go into? I'm like, well, it depends on what you want to go into, because you have to start building these relationships very early. And if you take a chemistry or OChem or physics early on, and you need to have a science professor letter of some sort, then you need to try to build these relationships early on with your professors, and so that you're not just one in a class of 100. What can you do to stand out? And I tell my students, even though you may not be applying to medical school until 2 years later, try to ask for the letter early, like when you took the class, and bank it. So that it's still, once again, not this lukewarm letter, like I knew this kid when he took my class 2 years ago kind of thing. So never ask for a letter of someone that you really don't have a relationship with.
Okay. We have 63 questions on the chat box, which is great. And we have like 9 minutes. We're going to try and go through these really fast, as many as we can. And this question has come up several times. And Dr. Watt, you can't ask this question because I don't want you to start cursing. But a student asked that they didn't do well on step 1, but they hope to do better on step 2 to make up for it. But they're unable to take step 2. What should they do? Anybody except Dr. Watt? Plus, we haven't heard from you in a while. You want to comment on that? You might be as bad as Dr. Watt. I forgot who I was asking. But anybody want to comment on that?
Dr. Jones, was that for me?
Yes.
You should be studying for step 2. People are going to use screening things. You just cannot go through all the applications. And so I think I understand the frustration and the concern. But right now, while you can take the test, my recommendation is study and try to excel on step 2. You can't do anything about where you are with step 1 at this point. And hopefully people will, to be honest, show you some mercy, because many of the screening criteria actually uses step 1. So do your best. And if you have a great otherwise application, you hopefully will be fine.
So, okay, so we're going to try and get to, I got to call this one out, Clarence Clark II, because his dad was one of me and Dr. Watt's instructors. He says MCAT's been canceled twice, and he's worried that he might not be able to take it in a timely fashion. Let me see what the question is. Do you advise medical applicants to do their MCAT test dates? What do you expect? Okay, basically he's asking, what do you do if it keeps getting pushed back? We really don't have a choice. You just have to go with the flow and just take it whenever it becomes available. They are including more testing dates as well as more tests on a particular date. So they're going to try and get it in. And it's been mentioned by this committee, admissions committees are going to be sensitive to that.
Let me add one thing to that, Frank, Dr. Jones.
Yeah.
I think all students, Clarence and everybody else out there, that when you study for this MCAT, you should take the test and you should continue to study for the MCAT just like you did. You get the test scores back in 4 or 6 weeks, and the score is not where you wanted it, you're ready to sign up for that test tomorrow. If you stop studying and do not pass, now you're going into deep depression and you don't have time to take it again. So my recommendation to all students, I got that from my colleague here, Ms. Lakia Young, who's now our Director of Admissions, that students should continue to study just like they were. If the test number comes back right, they can stop. And then otherwise for it.
Oh, a lot of questions coming up about starting late. Everyone's still trying to figure out what we're going to do about that. But there's one question that kind of alludes to, and I don't know who that's from. Is there any benefit from having online courses? Do you see any silver lining in this, having online courses? I know our students at PCOM were up in arms because they have mandatory classes and they don't want to have mandatory classes. We see now that we can deliver information without the students being in class. So that's one silver lining, but can you see any other silver lining for having these online or distance learning courses?
Well, I think particularly for medical schools or any kind of graduate program, online coursework isn't anything new, really. Particularly in our medical school, where we've traditionally had or giving students options. You can either come to lecture, or we stream our lectures and they're recorded, and you can do online learning at your pace. And it depends on the learning style of the student, really. But I do think that there's benefit to having online lectures because it allows for you to repeat the information, to go through the information at the speed at which you like to go through it, and do it in your own time, where you're not required to be at a certain location during a specific time of the day. And when you're talking about this large volume of information that medical school brings, I actually think that's a great idea to be able to go through the information at your own pace, but you have to be very disciplined. And if you're not very disciplined, then perhaps the online learning style is not going to be good for you. And you do need to be required to be somewhere at 8 o'clock every day to receive a lecture.
If I can be
let's try to get
I thought
to
she said it well. I'm just going to say it allows you to go forward. I thought Dr. Schofield said it well.
And I think an interesting pro I've seen is I've saved a lot of money doing online. I don't spend money on, food the same way, driving. So there's definitely a lot of pros.
Okay, that's a good point. A lot of questions about when should you apply? Apply early. The first date of applying has not changed. I think it's May 4th for applying to medical school. So still apply early. Let's see. One thing I will say, all these, we're getting even more questions now. So this is telling us that this is really a subject that people want to hear about. So I'm going to ask you all to commit to this again in the near future. We're getting so many questions, and then once people see the recording, we're going to have even more people that want to join. We still have almost the same number of participants as when we started, so people are really into this subject. Let me just see if I can find any. As I'm looking for some other questions, why don't we start? Like Dr. Higgins, just give us your final comments, brief. Everyone, please be 40 seconds or less as I look through some of these other questions.
So my brief ending comments are, whether you're applying for medical school or residency, remember that everybody is going through the exact same situation across the country. Everybody has had their clerkships cut short. Everyone is worried about whether will be able to take step 2 or not. And so you are not the only person whose application reflects that, because we're all going through coronavirus together.
Okay. Dr. Rose?
I think
let me ask you a question first, Dr. Rose, before you go, because it came up here. The med school interview, if we have to do it on Zoom, can you get enough from that person in a Zoom interview,
I believe so. We interviewed our last 50 candidates by Zoom, and I think it worked pretty well. The faculty adapted well. Obviously, what was missed is just having the students on campus so they get an opportunity to see our campus.
Very important.
But we felt that we actually could do a pretty good job actually with the Zoom interviews. You definitely lose a little bit of that interaction though.
Okay. Dr. Heron.
I'm just going to channel Dr. LaFall, equanimity under duress for all my license out there.
I love it.
You got to embrace change. You got to learn, grow, and lead. We're in a new decade. In 1920, women got the right to vote. So it's 2020, y'all got the right to vote and move forward. So you know what, if our ancestors can do it, we can do it. That's all I got to say about that.
And you haven't had a chance to say much about, you're one of our leaders in the emergency medicine world. Anything you want to say about to those students that want to apply for emergency medicine?
I mean, the data tells us you got to have a tolerance for uncertainty. And so if uncertainty gets you upended, this is not your specialty. You got to be cool, calm, and collected. And if you're expecting things to just roll like that, it's not going to work very well for you. You want me to be cool, calm, and collected when you see me in the with COVID. So you got to be able to handle change, nimble, and fluidity. That's what you need.
I love it. That's my former student right there, Dr. Rose, and you too, from Howard University. All right, Dr. Phillips.
Thanks for having me. Just good luck with everybody, wherever you are on your journey. I just want to say, I can't say it as eloquently as Dr. Higgins did or Dr. Heron, but we still don't get to be mediocre. So make sure that you're being exceptional in everything that you're doing. And sometimes you'll fall short, but if you're striving for that excellence all the time, you'll mostly get what you need to get.
Okay. Let me just throw one more question in there real quickly. Someone asked about the utility of pursuing an MBA during medical school. I think there is some utility in doing that. So yes, if that's something you want to pursue, I think that's a good idea. Miss Hester, and again, I have to just give a shout out to Miss Hester for what she has done for my two sons. I can never thank you enough, and the folks at Woodward Academy here in College Park, Georgia. This is a phenomenal school. Thank you so much.
Well, first of all, thank you so much for inviting me to take part in this. I have learned so much from all of you. This has been a very rich conversation for me. And this is something I think applies no matter where you are. If you are in high school, you're in college, you're in med school, wherever you are, here's the thing to remember. At some point in every storm, the rain will run out. Every storm runs out of rain. And so where we are today versus where we're going are two different places. And so I love that piece about being flexible and learning to embrace uncertainty. But at some point, this is going to end. Every storm will run out of rain at some point. So just hang in there. You're going to get through this. Just keep breathing.
Okay. See, I told y'all she's the smartest person in the room. Miss Fatima Starworth Bay. Fatima, can you hear me?
Yes, I'm sorry. I was trying to unmute myself. I just want to encourage everybody, and just some words of wisdom is just don't be afraid to ask questions. If you have questions about admissions, about rotation, whatever is going on, don't be afraid to ask those questions, and don't feel like you're getting on anyone's nerves or annoying them. Ask the questions, because if you don't ask, you won't know.
Okay. And another question from another one of my mentees, Miss LaSarah Bell, who will be a phenomenal doctor one day. And she asked about reapplicants. And she's in that. Is there anything they can do during this time? Unfortunately, there's nothing different we can do right now, but just keep pushing forward, LaSarah. And I have no doubt that you're going to be a phenomenal doctor one day. And she's applied to some of those schools. If some of you admissions officers out there, deans, she's on waiting lists. So we want to see her in school this fall. I probably shouldn't do that, but I did it anyway. Ominovi?
I would just say, in this situation, we've lost a lot of control over different aspects of our lives. So focus on the things that you can control, your own mental health, physical well-being. If that's doing yoga in your room, do some virtual, happy hours with your friends. Do what you can to take care of yourself and take back the little control that you can.
Okay. And we haven't even talked about mental health. We had a session on mental health 2 sessions ago, and it was phenomenal. So we could spend a whole day talking about that. Dr. Sophia.
I was just going to say that everyone's journey is different, and that we must just remain steadfast towards your goals.
Okay. Another one of my mentees, Sonia Randolph. Okay. Dr. Bradby.
I guess my pro would be to make sure that you remember to exhibit grace to everyone around you. In addition to your faculty, your staff at your institution, regardless of your pre-med, you're in medical school, you're a resident, they're all experiencing a lot of the same emotions and uncertainty that you are right now. And particularly for those that are applying for the next step, if you come out of pocket at these people in your frustration, it will be remembered negatively. And so make sure that you remember that everybody is human and everybody is doing the best that they can with what they got.
Okay. Dr. Bradley, how big is your program at East Carolina?
I have 36 categorical residents and 10 EM/IM residents.
Okay. Well, can you save 34 of them for our students that we're going to funnel your way next year?
Sure.
We appreciate that. Dr. Collins. Shout out to my frat brother. I got 2 frat brothers on here. We always have to shout out to our frat brothers, Sarons, all that stuff.
There it is. There it is.
Some AKs. We got a little bit of everything.
Brother Dr. Jones, thank you. This was, I probably enjoyed this more than many of the students. To my colleagues, it's been great to hear from you. I feel like you. I had one of my students, Cassandra Bradby. You look and sound exactly the same. Very proud of you. Very proud of you. But similar to ER, I forget which one of my colleagues, I think it was Dr. Heron who just mentioned, family medicine, we deal with lots of uncertainty. And as people of color, we are not strange to adversity. So let's not act like, the wheels are going to fall off. But I'm just going to share my pearl, which is simple. We've been hearing a lot of people talk on TV. We should all remember that when the experts disagree, the ignorant are free to choose. And we should read, and come up with an educated opinion for ourselves.
That's the bruh talking. That's the bruh. Before you come up, there's another frat brother coming up, but we have Malachi Brown. He's on the e-board for MAPS. Shout out to you, Malachi. He says he's going to be spreading all this information to his members. I mean, we are getting some phenomenal comments in the section about how great this has been. So we've got to do it again and again and again. Brother Watt. And I got to say, Brother Watt has gotten so many minority students in at Wright State in Ohio. I mean, he's known across the country. Everybody knows Dr. Watt. He's doing phenomenal things up there in Ohio. And all of us are doing phenomenal things. But I want to shout out everybody. Go ahead, Brother Watt.
Yeah, well, I want to thank you, Dr. Jones, and Atlanta Medical Association for putting this thing together, because these are the things that we all need to see and see faces, and some folks that I see on here I know from AANC and haven't seen, but a lot of you guys that are on here, I got students, former students that are at Emory doing this or that and the other, but I just think that during this time there's a lot of uncertainty and we all want answers, right? But as we know, we don't know. God knows, and it's on God's time.
All right. Before you go, Dr. Johnson, I got some more students are wanting to know if they can contact you all personally. We can work that out. If you all would like to be contacted personally, just let me know, and we can supply that. But I'm sure just about everybody knowing who you all are, you'll be glad to have students contacted. Dr. Johnson, my colleague at Morehouse School of Medicine, she's doing some phenomenal things. She's revolutionized surgery at Grady, along with the OBGYN department, Dr. Phillips, with the robotics and everything. She's a star in the making. Obviously, she's already a star. What words of wisdom do you have for us?
Well, thank you for a wonderful session. I've really enjoyed this, and I've enjoyed collaborating with you all. I wish to say to the students, have heart, good luck. These are challenging times, but you're not in this alone. Continue to reach out for advice, for knowledge, for mentorship. This is all key. And remain positive and study. Study, study, study.
Okay. Well, now I called out all the Greeks. We got every Greek represented here, so that's good. We always like to call that out. And but I can't thank you all enough for participating. Just by the comments we're getting in the chat, this has been very helpful, and we definitely would love to do this again outside of COVID. I mean, there's so many questions that we didn't even talk about specifics about interviewing and picking the right school and picking the right specialty. There's so many other things, and we need to just fill up the pipeline. I mean, there's so many people that we have to fill up the pipeline to get students in. I have to give a shout out to my organization, Pre-Med Solutions, where we're helping students get into school. Our organization, www.premedsolutions.org, .com, I'm sorry, where we're helping students get into school, and that's our focus. We need to get more folks in the pipeline. Again, this is the Atlanta Medical Association. This is our Ask a Black Doctor series. We invite you to go to our YouTube site, ATL-Med, for the Atlanta Medical Association, or you can go to the atlantamedicalassociation.org website, and you can see the replay of this. And I'm hopeful that students that are listening really will get a lot out of this. And what I was thinking about doing too is, since we're all just sitting around not doing anything, I know no one's busy, we might actually jot down some bullet points so that we can actually come up with a document that answers some of these questions for students, not just these, but some other questions going forward. Also want to reach out. We know that there are a lot of folks there from Atlanta that are listening. If you're in Atlanta, if you're a physician in Atlanta, and you're not a member of the Atlanta Medical Association, shame on you. We want you to become members of the Atlanta Medical Association. We're doing some great things, having a lot of fun. And also, there's a survey. We want everyone to fill out the survey so we can figure out how to get better as we do these things. But please, everyone stay safe. One thing we were talking about today that and I'm sure y'all have noticed the same thing. Our community doesn't really realize how serious this COVID thing is. I mean, you walk around, no one has a mask on. If they have a mask on, it's just covering their mouth. People in the food stores, they're keeping gloves on all day, not taking the gloves off. It's up to us to educate our community. And then we'll be able to open school up in the fall. It's up to us to get testing for our community. So we've got to take the lead. We can't sit back and wait for anybody else to do it in our own little communities. We've got to take the lead. And so let's work together. Again, thank you all so much for participating, and we'll be calling on you again soon. This is the Atlanta Medical Association Ask a Black Doctor. Thank you all for participating.